Welcome back to AM Northwest. Well, most of us have heard of physical therapy rehab, but what about pre-hab? Here to tell us why it could be a game changer before your hip replacement surgery, we welcome back our health and fitness expert, Beth Oliver. Hi, Beth.
Good morning.
You have experience with this.
Yes.
You had your hip replaced.
I had one hip replaced about 10 years ago, got another one coming up in the fall. So one of the things that I experienced is getting advice from somebody to do therapy before the surgery,
Right.
which surprised me because I hadn't really ever thought about it. But it really makes sense for a couple of reasons. First is, typically if you've got a problem, maybe it's arthritis or maybe some sort of injury in your knee or your hip, even your shoulder, you tend to start moving less and less because it's uncomfortable.
Right.
So I'm not encouraging people to move in it if there's pain,
right.
but to keep moving pain-free and to strengthen whatever areas you're going to have surgery on is really important, because you literally want to go into the surgery as strong as you can.
Exactly.
So your recovery on the other end
Right.
is quicker.
If somebody is in a lot of pain, is there a way to find a movement that would help them that wouldn't cause pain?
Typically, yes, and sometimes it takes a little bit of work, but that's where a great physical therapist comes in
Okay.
handy. One of the things that I found was taking some of the exercises that I was uncomfortable on land, but putting them in the water was really helpful, which was a great way for recovery. And post-surgery, I did a lot of work in the water too.
Oh, that's great. Oh, I just remember when you did that you couldn't move before your hip surgery that well, and then after your hip was so like back to normal.
Yeah, my mobility in the hip that I've had surgery on is excellent, as good as it's ever been, even when I was
Amazing.
growing up in dancing full-time and all of that.
Right.
Yeah.
Okay. When's your upcoming surgery?
In September. Yeah.
Okay.
I wanted to
Wow.
get through the summer.
Yeah, that's good. Okay,
Yeah.
so show us what we need to know.
Okay, first of all, we're going to do some tricep push-ups, which
Okay.
might seem surprising when
It
we're
does.
talking about a hip, but you're going to be using your upper body strength to, number one, you're going to be on crutches for a while.
Okay.
So you really need to have some upper body strength.
Oh,
And as
okay.
well, Tammy, you use your upper body strength a lot because you won't have access to both feet, so
Yeah.
you'll be getting yourself up and down out of chairs with a little push off. Even getting into your
yeah.
car,
Okay.
you kind of back your rear end in, and you typically catch your weight a little bit
Okay.
to set yourself down. So surprising, right?
It
But
is surprising.
That's one of the things you have to think about, is how I'm going to be moving after.
Okay.
So then we're going to
Genius.
start to train all the little supporting muscles that surround the hip.
Okay.
So super simple, just going to do our little quadricep extensions. And I know that some of these movements seem like almost silly and mundane, but the smaller muscles are the ones that have to post-surgery sort of reconnect onto the new
yes.
surface. So you've got to start with the little stuff that's closer to the bone, in a manner of speaking.
Yeah, yeah.
Right, and if for someone like you who's already has a pretty good movement vocabulary, a therapist might actually have you put a little ankle weight on or something like that.
Okay.
And you do both legs,
Of course.
right?
Yeah. Yes.
Because you tend to think about the leg that's going to have surgery, but your other leg is going to be working awfully hard to take a lot of your weight as you're moving up and down. So speaking of all those little muscles, then what we want to do is come around, and if somebody's not quite so stable, they can just use a chair.
Okay.
And we're just going to do little extensions to the side. This is one of the first things you'll be doing post-surgery. And one of the reasons I like people to do prehab is it just gets you in the habit of doing these movements.
Yes.
Because at first your psychology can be like, oh, brother, what is that?
Yeah.
Especially,
Oh, brother.
especially for someone who moves a lot.
Yes.
But again, it's just important to get in the habit.
Yeah.
And then the same thing extending to the back.
Okay.
So essentially what we're doing is we're moving the thigh bone around in the hip joint, all the movements the hip is going to need to do.
Oh, nice.
Right?
Yes.
So now we can up the ante a little bit. I'm just going to move this in a little bit.
Okay.
To a single leg deadlift.
Oh,
So
okay.
again, for someone who's just maybe a little bit newer, you can just tip over and you've got the chair
you've got
there
the chair.
for a
Okay.
little support. Right?
Okay.
But
Yeah.
then for somebody like you, Tammy, I'd have you step away from the chair and
Okay.
put a weight in your hand.
Do you put it in the And the hand of the leg that is going
the leg
away?
that's going to move, yeah.
Okay. Okay.
And of course, you could actually have weights in both hands.
Okay.
So you're strengthening the
nice.
ability of the hip to move
Yes.
back, but you're strengthening your stabilizers on the supporting leg.
And your core, because you have to balance, right?
Exactly. And balance is a really big issue because as you start moving more post-surgery, that's one of the things you want to be really conscientious of. That's the biggest thing with hips, is being able to be stable after so you don't fall.
Right. These are things we don't think about.
Yeah, that's the big issue.
Really
right?
smart. Okay.
So now we're going to get a little bit more isolated. We'll come on down to the
you need
ground. You're going to need
Oh,
it.
I need that. Okay.
And
Thanks,
I'm
Beth.
just going to fold this mat in half because we won't
Okay.
need the whole thing.
Oh, okay.
And then we're going to come down to the ground.
Okay.
Yeah, we'll go a little diagonal here.
Okay.
And do a pretty functional exercise called a bridge.
Oh, okay.
Where we're all the way down.
Oh, I see why you turned back.
Yeah, sorry, I should have thought about that earlier.
Maybe I'll go sideways. Okay.
Yeah, so we just press the hips up
Okay. Gotcha.
and then release down. And that's sort
Okay.
of the base of the movement.
Okay.
But we talked about the fact that you're going to be balancing on one leg.
Yes.
So now we're going to make it a little bit more challenging for you, Tammy, by
Okay.
having one knee up in the air.
Okay.
Yep, and then, so this is a single leg bridge.
Okay.
And so this is really probably the big fundamental movement
Oh, yeah.
any therapist
This
is going
is
to have
harder
you do.
than it looks, by the way.
It is. And then you can take your band
Okay.
and you just slide it right up your legs around your thighs.
Okay.
And you can, of course, do the bridging with your band.
Okay.
You want to try a couple of those?
Sure. And what do you do? Just push your...
Same thing. I
Okay.
want you to do one-legged. So one knee
Okay.
comes up, and
Oh.
then the hips move up and down.
Okay,
Yeah. So
got it.
bridge and release. So now you've got a little extra resistance.
Okay, that's good.
Yeah, and those are really fundamental movements.
Okay.
And
Oh, that's
then
good.
one more.
Okay.
We come to our side.
And am I
This is-
keeping my band on?
You're keeping your band
Thank
on.
you. It's a gift.
Take it as a compliment. So
Okay.
we come all the way down to our side. We've got our knees together.
I'm trying not to
No, that's
flash
good.
anything.
No,
okay.
you'll be good there. Yep.
Okay.
And
Okay,
then
good.
pull your knees back a little bit more in line with your
Gotcha.
hips. Yep. And
Okay.
then you keep your toes together and you
Okay.
lift, you roll your knee
Oh,
up. Yeah.
okay.
Clamshells.
Gotcha. Okay, gotcha.
And these are really good for stabilizing all the
Oh,
muscles
yeah.
around the pelvis. And it's
is
again,
good.
it's a lot harder than it looks.
It really is.
And you would do at least 15
Okay.
and then take a rest, and you'd probably
Okay.
do a couple other sets.
Okay.
So really important to go into surgery as strong as you can.
Yes.
Train both legs or both sides, surgery and non-surgery. Just get in the habit, because post-surgery you'd be doing exercises like that. Probably your therapist would probably want you doing them twice a day.
Okay, so
Yeah.
get in the habit now. Okay, thank you so much, Beth.
You're welcome.
We're going to have these tips on our website at kat.com, and we'll be right back with more AM Northwest. Stay right there.